I'm Dr. Nate Bockholt, a urologist from Sioux Falls, South Dakota for the group Urology Specialists. Today I'll be talking about lower urinary tract symptoms and specifically lower urinary tract symptoms in men. Lower urinary tract symptoms tend to impact 90% of men middle-aged up into their 80s, whereas 50% of those men can have moderate to severe type of symptoms. Symptoms can include waking up at night, slow stream, feeling like you're not emptying well, going to the bathroom too often, or getting a sudden urge where you feel like you may not make it to the bathroom in time. As men age, their prostate tends to grow, where 60% of men at age 60 and 80% of men at age 80 can have some evidence of growth of their prostate if you examined it under the microscope. But the size of the prostate doesn't always correlate with symptoms. There's other reasons why guys can have lower urinary tract symptoms, such as certain behavioral choices, medications, not just the size, but the shape and even the tone of their prostate can influence their symptoms. There are some men that tend to just limp along in life with a low level of bother with their urinary symptoms, even though they could potentially be causing irreversible damage, not just to their kidneys, but also regarding their bladder function. There are some guys that are symptomatic and they do tend to seek out treatment, and treatment can be anything from medications, behavioral changes, herbals, but there are some times where a procedure or a surgery is involved. There are some surgeries nowadays that are relatively less invasive compared to the old type of surgeries where we'd have to use a bigger scope, people would have to stay in the hospital overnight. But there's other options where you can either have a smaller catheter, and sometimes there's procedures you can have done to help you empty your bladder better and improve your quality of life, where you go home even without a catheter. So there are times where you have to be somewhat proactive, just like people with high blood pressure that they don't necessarily feel their high blood pressure, but there's certain measures they need to take, such as medication, to prevent bigger problems. So there are some men that have symptoms that if they wait too long, the symptoms not only can get worse, but they can cause more damage. So I do recommend that men that are having bothersome urinary symptoms, such as the ones I described earlier, that they seek out an appointment with their primary care provider or seek out an appointment with someone from the urology team.